surgery was having a lot of abdominal pain and nausea and vomiting.
Yeah.
And what the imaging has showed is a kind of a diagnosis or a term that we use that's called SMA syndrome, superior mesenteric artery syndrome. Has that been discussed with you guys?
They drew us the photo, so it was pretty thorough.
Okay, good. So when you think about the most common cause of SMA syndrome, it usually is seen in an individual who's had a good amount of weight loss and is thin. Did they describe to you how there's a little bit of a normal healthy fat pad that's there?
Yes.
Okay. So that's usually the cause, but it's rare. It has also been associated after or reported after spine surgeries. And I don't know if they talked about this part with you, but I've seen it myself in one teenage girl who had scoliosis, so where her spine was a little bit crooked, and she had an elective spine repair. And when you look in the literature and medical journals, it's been reported a number of times in other, usually it's teenagers who have spine surgeries done.
Okay.
And this is not something that's common knowledge to a lot of providers because it's not a common complication of spine surgery. And I didn't go digging into the literature to see specifically after spine trauma surgery if it's been reported. But in my mind, I thought, well, the surgery you had in many ways is similar to the scoliosis repair surgeries. And so is it that this is more related to the surgery, or is this more related to weight loss? And kind of the rationale behind the surgery, if it's related to the surgery, is that when we line up the spine or kind of straighten the spine, that if it kind of pulls things into a slightly different position, it might alter the anatomy or the angles, and that's why the vessel causes the blockage. As opposed to when it's related to weight loss, then we generally say it's because that fat pad that's naturally there gets smaller in size. There's a little bit of kind of kinking of the system. Okay. So as you were walking in, I was just saying, I'm curious to hear what your best weight was or your typical weight, and get a sense of how much weight you think you've lost since all of this has happened. What was your weight at, you think like a month back?
Like 135.
Okay.
136.
Do you remember what you were weighed at here?
136
Still
is what they have on the paper right there on the
okay,
wall.
and I think, let me look. I think there's only one weight. It's probably that same weight
Okay.
that's reported. Do you guys have a sense from, and your mom and grandma, or actually Jared, for you too, looking in the mirror, do you have a sense if he looks like he's lost weight?
Yeah, he does.
Okay.
It's been, what, 10 days
11
since
days.
since he's eaten.
Yeah. Yeah, so they only have your admission weight.
Didn't they get a weight on him today with the bed?
232 pounds.
So,
The bed
but
was
that's
messed
not
up.
it, for
No.
sure, unless they could just easily subtract the bed. But one of the things I'd like to do is try to get an updated weight.
Yes, we tried today, and so they zeroed out the bed when he was in PT.
Oh, good. Okay.
But then when they put him back on, that's when it said it was 232
Okay, so that's,
pounds.
I mean, they'll figure it out. We'll just
Yeah,
give it another
they're
try.
gonna do it again tomorrow
Okay.
and see.
But kind of regardless of what that shows, when you look at the literature for whether it's the scoliosis surgery or related to weight loss, certainly for individuals who have the SMA syndrome related to weight loss, typically when you gain that weight back, the problem fixes itself. With the post-surgery, it's a little bit of a mixed bag. Some people with additional weight gain and time, their symptoms get better, and other people we need to think about some other ways to fix the anatomy and kind of the issues. And so at this point, I think the teams that are involved, because you have a lot of different specialists kind of looking in on you, the teams that are involved are all kind of saying the same thing. And the term I use is, let's get you nutritionally rehabbed, right? You're talking about the physical therapy and that stuff. So we need to do some nutritional rehabilitation to try to get you a little bit stronger again in terms of where you're at with your weight and your fat stores and that sort of thing, and see what happens with the GI symptoms from there. And we have two ways we can give you nutrition when you're not able to eat by mouth, and the options are IV nutrition, which you're getting a little bit of now in the bag that they're hanging every night. I didn't do the exact calculations, but you're getting roughly ballpark, I wanna say it's like around 1,300 calories, in that kind of ballpark. But we're limited in how much we can give through a peripheral IV, and if we wanted to maximize or optimize those calories, we would have to have a different type of line.
That's what they talked about,
Yeah.
Okay.
But you're getting some calories
So
there.
that's still in the
So-
talk of doing the other.
Yeah, and then the other option is to use your GI tract, to use your intestine to give you the calories. And that would be done with a tube that's thinner than the one you have in now and more comfortable. And it would go past your stomach, past this area of blockage.
And would I get rid of this one?
Good question. Maybe yes, maybe no. Kind of depends on if you still need that one for drainage. But even if you still need that one for drainage, you'd be able to get your nutrition delivered further downstream, further down.
What's the time frame we're looking at to do that?
To get one of those things done, the different IV line or the, I think we should make a decision in the next 48 to 72 hours kind of thing. And what I mean by that is that, what I asked the team to do today was to take your tube off of suction and put it to gravity, kind of see how you would tolerate that. And then we can reassess tomorrow. And part of the reason for that is ultimately we need to think of how we're going to get you home safely, right? And you could go home with this feeding tube that goes a little further down and help you gain weight and have more time to recover at home. And this would be a temporary feeding tube, just to make sure you understand this one that goes in your nose is a temporary one, okay? But I don't want to put it in tomorrow if we don't think it's going to be kind of the fix to the problem, right? And what I mean by that is if you're still having a ton of vomiting, do we want you to go home with, with both tubes in? Can you tolerate having both tubes in, one for feeds, one to drain? So just want to kind of see how things go in the next 24 hours, okay? And then the line, to get that deeper line, and if you need the line for IV nutrition, we can get that done pretty quickly too.
What is like the determining factor, like in the 72 hours, what are we looking for?
I think it's mainly kind of just to see how things go with this. Yeah.
And does this look pretty normal, is what? So
It's a
far
lot,
it's done?
the color looks pretty typical and the volume looks pretty small.
We were really concerned about the color on that, how dark it was.
Yeah, I mean, when you're suctioning, it's gonna be dark and you're
Okay.
gonna see more bile in it.
Okay.
Do you feel like you have more nausea since we made the change
No.
today? You feel about the same?
Yeah.
Okay, so that's good. And then part of it is just the logistics of getting him on the schedule. So for that tube to be placed, we're probably gonna need it to be done endoscopically. So with the procedure where you'd be asleep and we would look inside and pass the tube beyond the
with the
carpet.
camera, they said, okay.
Yeah, so it's partly just kind of logistics of getting that time on the schedule. Yeah, and then if for some reason it seems like we can't do the GI tract side of things, and we need to do the line, that we can get done pretty easily based on his age and his size. Should be pretty easy to do. Okay. But generally speaking, when you think about kind of the trade-offs, the risks and the benefits, if we can do the nutrition through the tube, cosmetically it's not pleasant, right, because you've got the tube there, but medically speaking it's a little bit better, a little bit safer for you in the long run. And again, just because I want you to hear me say this, that would be a temporary tube that you have in place, okay? So how does that all sound just in terms of the overview?
Good.
So it's okay? Okay.
I'm hungry.
I know. I
Yeah.
didn't want to bring my food in here, but
Oh,
I had just got
sorry.
it, so I just ran over here.
Sorry about that,
It's
yeah,
okay.
you can smell it, yeah.
Yeah.
I know you were drinking a fair amount before. Do you still feel really thirsty now, or do you think are your fluids a little bit better? Have we caught up with
Yeah,
you?
I'm thirsty.
You are still thirsty.
Yeah.
Are you peeing a lot?
Yeah.
Okay. Is that just a habit or
I
anything?
think it's on this side now that he rolled
Yeah,
over
it's
to
done.
his side.
Here it is actually a bit dark.
Yeah, it was pretty dark, huh?
Yeah, maybe you do need a little more.
That's what I thought would, I noticed that earlier, it was pretty dark.
Yeah, they were saying I was dehydrated.
Yeah.
Maybe that's why I didn't take last night.
And maybe that's why you had a headache, yeah, and then you were dizzy for PT, so we couldn't really sit up very long
Okay.
today.
I'll check with the team about where they're at with your fluids.
Okay.
Because we've been trying to keep up with how much you're losing through the drainage bag.
Oh, yeah.
But it's always we're always kind of chasing ourselves. So now that you're putting less out, that might actually help us catch you up a little bit better. Because I think the nurses are, it's kind of like, despite their best efforts, they're always like 6 to 8 hours behind because the way
Yeah.
they count and then replace and then count.
Just a random question, reading about SMA, at what point do you determine, like after you've done the feeding tube and all that, at one point do you determine whether if his body is rejecting it or if it's not working, do you do surgery? Like how long,
So
or
it's-
is that
it's
just a
definitely-
random
well, no,
question?
it's a case by case decision.
Yeah,
The young woman who I saw who had the scoliosis surgery and had this come up afterwards, in that context, the decision was made very quickly to have her moved to surgery because she wasn't really underweight and it very much temporally related. And we said, why are we going to drag this out and do IV nutrition and
Yeah.
J tubes and all this stuff? Let's just fix it while we can fix it. I will say for the SMA syndrome cases I've seen that have been related to weight, some of them it's been a long time coming that we've done the nutritional rehab, meaning months potentially to get the weight
okay,
up to where we want it to be. But that's when we've been, kind of on the other end of the spectrum of trying to avoid surgery as much as possible.
Mhm.
So I think, Jared, for you, it's a little bit too soon to tell, and it's gonna somewhat depend on what happens with your symptoms in the next few days, because going back to one of the earlier comments I made, even when you look at the scoliosis surgeries who had SMA syndrome, they did not all require surgery.
okay,
And also, they did not all have symptoms from the immediate get-go after surgery. Some of them,
Okay.
it was a week or 2 weeks out that they developed their vomiting,
Okay.
their pain. So I
Okay.
think the take-home message there is it's kind of too hard to tell at this
All right.
point. And it's somewhat of a personal decision
okay,
also.
okay,
So I think, to commit to surgery this week is too soon,
yeah,
but, to kind of see how things go over the next few weeks, I
Okay.
think is the right way
okay.
to do it. Yeah, and there's a lot of different options for formulas, how we would give the calories when we have the tube in place. And we have some formulas that are a bit more concentrated, that can give more maximal calories, in a shorter time span. The flip side is we also have to be careful not to push your calories too fast, too quickly, because if we do that, we know there's also some medical side effects there. When you haven't had a lot to eat and drink for a few weeks, you can't go to full calories quickly, because then you can have some changes in your salt levels and your
Yeah,
electrolytes.
yeah, makes sense.
But I think the bottom line is this is a crummy complication,
Yeah.
top of a very challenging situation already, but we have some, we have some different next steps, and we just kind of let it play out and see where Jared takes us from there. Okay? So there's fixes for all of us. I want to make sure you know that, okay?
Do you have any questions for everybody?
Check your tummy too.
Anything you wanna ask her, honey?
So in terms of what you're getting in your IV nutrition bag, I've been writing orders the last couple of days, and if I'm remembering correctly, you're getting about 500 calories from the fats. So that's the white bag that hangs and runs over 12 hours. And then I think it was around about 800 calories from the yellow bag. The yellow bag is yellow because vitamins are in there, and that's what makes it yellow. But there's also sugar, dextrose, carbohydrates, and then proteins in the
Okay.
yellow bag. And you're getting about 60 grams of protein, I think, if I remember correctly. So probably could use a little bit more, but we're limited with how much we could put in there, because
Okay.
otherwise it gets too concentrated and it's
Okay.
not safe.
Sure.
to run.
What are we looking at in terms of when he could have like a drink of water or something?
What I think now you're allowed to have 500 mLs per day. Is that right, or what
I
have we
don't
said?
know.
He's not having anything.
And he's, yeah.
So the medical challenge is if you drink and then it just gets suctioned right out, it can make it hard for us to keep your salt levels
Right,
safe.
that's what she explained.
If it's like a few sips for comfort, I'm totally fine with that.
Okay.
But what we want to be cautious of is we're kind of testing to see now how much is going to come out and how much is going to work through.
Yeah.
Okay.
So if you drink and then we start seeing it come out, it makes it more of a challenge because it's not always a one-to-one, right? So if you drink 30 milliliters, it's not always 30 milliliters that comes out, right? It's not exact. The other number that may help you is that the stomach makes, on average, 1 milliliter per kilo per hour. So you said your weight was 130. So your stomach is making about 2 ounces an hour of fluid. And if some of that is passing through, we should see less than 2 ounces per hour come out of your drain. So when we look at a period of 12 hours or 24 hours, those are the numbers that we're kind of bouncing around. How much did he drink in? How much did he drain out? How much would we expect him to make from just his normal stomach secretions that we all make? And then kind of quantify how much of that passed through and how much of that came back out. The other thing we'll be looking for with you is bowel movements, because as your secretions start to pass through, if they are going to pass through, we should start to see a little bit more frequency with your bowel movements.
So can he, like, say for instance, once an hour, can he have a sip of water once an hour or no?
I mean, in a perfect world, it's easiest for us from a medical perspective to have you not do anything by mouth, because it gives us a clearer picture.
Uh-huh.
If you're miserable and you feel like you have to have something, then a sip every
Okay.
hour, when you're awake, I guess would be okay.
Okay.
The other thing you can do is moisten your mouth. Have they brought you those sponges to moisten your mouth?
Yeah, but they
But
didn't put in
they
multiple
just-
water
we
on them.
barely just heard today that you're supposed to wet them first.
Oh, okay.
And so he was getting dry ones. He's like, I don't like these.
Yeah,
I
so
don't do
put that in
anything."
some ice water or something like that. Yeah. Yeah. Okay. Oh man, sorry guys. Just gonna look at your tummy now. So do you have pain right now? If I'm pressing lightly, you feel okay? It's okay. Okay. If I press a bit harder, you okay? Okay. All right. Well, that's good. So if we do the math for you, then here's just his
Oh,
weight.
it's under the tape, 136.
The kilos, let's just see. Kind of optimistic that
2 kilos.
that's not that much there. So yeah, he would make about 60 milliliters an hour. So in a 24-hour period, it's about 1.5 liters that his stomach makes normally. So that's for kind of any person his size. So if we see less than 1.5 liters come out, that means the remainder, approximately that much, is passing through, which is good.
Good.
Yeah.
Okay.
So that's kind of where the numbers come
Okay.
from. Okay. What else? Other questions? Good for now? Okay. So I'll talk with the team and I'll give you an update tomorrow in terms of where we're at. And my guess is if we're gonna do a tube, it would probably happen on Friday, but maybe happen on Thursday. Today's Tuesday, right? Just kind of depends on availability of the
Could I
team.
get some tape to tape this up onto the bed right here, please?
Yeah, does your mom have it? Or otherwise we can find the
I
process.
don't know.
Okay. Okay, I'm gonna let the hospitalists know that I connected with you guys, and then, I'll check in with them.
Thank you.
Okay.
Okay?
Thank
All right.
you so much for that
Thanks.
information.
Thank you.
I'm gonna take it.